I was at a doctor's appointment today, and I was told that they don't know if they can have a contract for a technician to come in to do echocardiogram scans for the rest of the year.
So we can't be vulnerable to attacks like this. We see that cuts keep coming down. When we are split, when we're united, we can have excellent health care, and we already have the money to do it.
Hey, it's Jordan with Status Coup.
This is Ashley with Status Coup.
On the ground.
In Philadelphia.
Flint, Michigan. East Palestine, Ohio. Please support the leading independent news outlet on the ground,
Covering what the corporate media covers up.
Hands off Medicaid! Hands off Medicare! Hands off Medicaid! Hands off Medicare!
And why is it important?
Anniversary of Medicare, and I taught for 46 years in the City University of New York. And I'm and I have pushing Medicare, and they're trying to take it away from the city of New York. That's the retirees in New York City and the federal government as well.
And what can be done to save these programs?
Everybody out on the streets is being attacked, which is everybody except the MAGA people.
That's right.
Hi, my name is Dr. Betty Kolod, and we're out here because it's the 60th anniversary of Medicare and Medicaid. These are incredibly popular and important programs that provide health care, not just for people who are low income, not just for people who are elderly, but for people with disabilities, people who are reliant on living in nursing homes. And as a primary care doctor, my patients are going to suffer if these programs are cut. If Medicaid is cut here in New York, if Medicare is privatized, my patients won't be able to get their medications. They won't be able to get the care that they need at home in order to be safe at home. I also work with people who have addictions, and so these people are particularly vulnerable when it comes to healthcare cuts. So that's why we're all out here demanding the solution, which is the New York Health Act. New York could be the first state in the country to have truly universal health care. So the New York Health Act would bring about a single-payer, universal health care plan that would cover everyone who lives in New York, regardless of immigration status. No co-pays, no deductibles, no out-of-pocket costs, and it would be the most excellent, comprehensive coverage in existence. So it would cover vision, dental, hearing, long-term care, reproductive health care, mental health care, and we would all be in this together. So our elected officials, the lowest income New Yorkers would all be on the same plan. So there would be an incentive to keep it high quality and well funded. So we can't be vulnerable to attacks like this. We see that cuts keep coming down. When we are split, when we're united, we can have excellent health care, and we already have the money to do it.
Today is the 60th anniversary of Medicare and Medicaid, of which we are both members of the recipients of Medicare. It's very important. It's our only income, and we are here to support that, and also to pressure Governor Hochul and all of the New York State lawmakers to pass the New York law.
Can you talk a little bit about this, the Health Act?
All New York State residents. Healthcare is a right. It's a right. Right? It's not a privilege, it's a right.
What are your thoughts? I mean, healthcare has been a big topic ever since Luigi Mangione. What are your thoughts about what's happening with that and healthcare, the healthcare system in this country?
Could be improved.
Yeah.
Yes, and things are already falling apart. I can tell the difference. I was at a doctor's appointment today, and I was told that they don't know if they can have a contract for a technician to come in to do echocardiogram scans for the rest of the year. And I'm like,
Wow.
Why? So, maybe they'll find somebody, but it could be funding.
Support this critically important on-the-ground reporting as a Status Coup member and get great perks. Become a member right here.
Love it. Impending. Medicare for all. We love it. Expanding. Medicare for all. We love it. Expanding.
We're out here today because it's the 60th anniversary of Medicaid and Medicare. And we know that the big, beautiful bill, which is not bill was passed and is going to bring massive cuts to Medicaid and to Medicare. And
When do these cuts go into effect?
they conveniently go into effect after the 20.
That's okay. I can't see it anyway. It's okay. Go ahead.
After the 2026 midterms, so the end of next year. So they think that people are not going to remember what they did, except that we are already seeing impacts of these cuts. We are hearing about hospitals closing because they anticipate a reduction in staff. There are staff that is already being reduced. So this is already having an impact, and we're not going to let people forget that. And we are here to ask our federal representatives to step up and do whatever they can to protect us from these massive cuts that are coming. And also for Governor Hochul and our state electeds to pass the New York Health Act, which is a single-payer system that we could have passed long ago in New York State, but they are wimps, right? They have not passed the New York Health Act, that's what they need to do, and that would give coverage to every resident of New York State, so that everyone would have coverage, which is what should be, right? Healthcare is a human right. Everyone should be covered, and when we're all covered, we're all better off, right? So that's why we're here.
States all across the country today that are gathering together to celebrate this wonderful holiday. That's right. For 6 decades, millions and millions and millions of people and American families have benefited from Medicare and Medicaid, and we're here to celebrate those programs together. But we also know that they're coming under attack under the very bad new big ugly tax bill. Boo! The new bill is going to take $1 trillion away from Medicare, $500 billion away from Medicaid. It's going to throw 17 million people off their health insurance. It's going to raise healthcare prices. It's going to destabilize health insurance markets. It's going to force hospitals and nursing homes and community health centers to close. And it's going to cause millions of healthcare workers to lose their jobs. Boom! So we're here to commit ourselves to protect and defend Medicare and Medicaid going forward. And we don't want to just protect them, we want to actually improve and expand both those programs. Yeah.